Hello everyone. Today, I'm diving into two significant obstetric emergencies that can endanger both mothers and their babies: placenta previa and placental abruption. Understanding these conditions is crucial for healthcare professionals, especially nurses, who are often on the front lines of care. First up, let's talk about placenta previa. This occurs when the placenta implants in the lower segment of the uterus, partially or completely covering the cervical os. There are three types: complete previa, where the placenta entirely covers the cervical os; partial previa, where it covers part of it; and marginal previa, where it's near but not covering the cervical os. The hallmark symptom: painless vaginal bleeding, usually in the second or third trimester. Diagnosing placenta previa involves an ultrasound, either transabdominal or transvaginal. But be careful, vaginal examinations are contraindicated here due to the risk of severe bleeding. Management depends on the bleeding severity and gestational age. Expectant management with hospitalization and monitoring is often the go-to for mild cases, while a cesarean section is usually needed if the placenta covers the cervical os. Now, let's shift to placental abruption. This is when the placenta prematurely separates from the uterine wall before delivery, leading to hemorrhage. It can be partial, complete, or concealed. Unlike placenta previa, the bleeding here is typically painful and may come with severe abdominal pain and uterine tenderness. Diagnosis is mostly clinical, based on symptoms like painful bleeding and uterine hypertonicity. Ultrasound can help but isn't always definitive. Immediate management focuses on stabilizing the mother with fluid resuscitation and blood transfusions if needed. Depending on the severity, an emergency cesarean section may be required to deliver the baby and control hemorrhage. So, what's the role of nurses in these scenarios? For placenta previa, nurses monitor vital signs, assess fetal well-being, provide emotional support, and prepare for cesarean sections. For placental abruption, the focus is on immediate stabilization, continuous monitoring, assisting in emergency delivery, and providing postpartum care. In conclusion, both placenta previa and placental abruption are critical emergencies that demand prompt diagnosis and management to ensure the safety of both mother and baby. Nurses are a vital part of this process, offering clinical expertise and emotional support during these stressful times. Thanks for watching, and stay tuned for more life-saving insights.